Vitamin D seems to have an important role in cancer, and you are investigating it. Tell me about the prospective study that you've been doing and what's coming out of it. First of all, what have you been doing in the study?
Yes, you're right. Vitamin D has a lot of action that have been believed to be important for cancer. It may prevent some cancer in population studies, and in some cohorts of patients with the disease, the higher level of vitamin D were protective or were associated with good prognostic factors. But in fact, most of these studies are flawed by various bias, and when you give to the patient vitamin D, you do not get improvement you do not prevent in most occasions cancer, or you do not improve the prognosis.
What did you do in the study?
In our study, we had a prospective cohort of melanoma patients that were recruited since 2003 to 2008, and we prospectively measured vitamin D level at diagnosis and during each semester. And we were able to demonstrate that the vitamin D level at diagnosis was associated with poor prognostic criteria of melanoma, high breast cell thickness, high AGCC staging, but at the end was not associated with poorer PFS or overall survival. And what was very new, we also looked at the variation over time of the vitamin D level, and we were able to demonstrate in the same cohort of patients that the patient with stable level of vitamin D have the better prognosis, but those patients who have a decreased level of vitamin D or an increased level of vitamin D over time have a worse prognosis, and it translates into a worse overall survival and a worse progression-free survival.
What is your interpretation of these fascinating data?
For the reduction of the vitamin D level, it seems that it is linked to inflammation, and inflammation is linked to development of the cancer. It is also linked to ulceration, which is a bad prognosis factor in melanoma. And some genes that are linked to inflammation are also hyperactive in melanoma cells. So it's easy to understand why low vitamin D is associated. Declining vitamin D is associated with the deterioration of the patient. But the increase was very difficult to understand. We looked at a patient that could have made some supplementation with vitamin D. And in France, there is the possibility to have vitamin D2 or D3 as a supplement. And the vitamin D2 supplement was not taken by more than 6% of the patients. But the thing is that we did not record the patient's exposition to the sun, which is the main source of vitamin D, and maybe this exposition to the sun is detrimental for the patients. But it has to be proven.
Right, so you might then have a balance between the melanoma causing properties of sunlight and the vitamin D generating effect.
Yes, this is the dilemma of vitamin D, but you can have vitamin D also by ingesting food or fishes, and so it's not a problem. Don't go to the sun, you get cancer. There are other ways to get vitamin D.
Right, now it seems then that doctors might well be in a position of giving advice on this, and the advice might be between supplements and foods. What's your guess about the way forward of how to advise patients?
Well, I don't know. There's a huge debate on the value of vitamin D. I think nowadays it is not so important, and to prevention of hip fractures, and the interest is not so important as that was before. For prevention of cancer, the evidence is rather low. So I don't know really. I'm not a specialist in vitamin D, and I'm an oncologist and a specialist for melanoma. And my opinion is that in the UK there is a trend to give to a patient vitamin D because of the works of Julia Newton-Bishop in Leeds. That she made the only trial that demonstrated that the low level at diagnosis were associated with poorer DFS, but we were able to demonstrate in our in our study published in GNCI that the way she analyzed her data was not correct, because she used a breast technique as a continuous variable, which is not. And if we made exactly the same analysis as she did, we find the same results, but with correct multivariate analysis integrating the AGCC staging, the breast techniques as a categorical variable, it disappears.
Right. Are you shooting vitamin D out of the water then at the moment?
I think vitamin D is not a direct role to play in melanoma. It is a proxy for something else. Maybe inflammation, maybe exposure to the sun, but it's only a proxy. And by action on vitamin D level, I think you are not going to improve something in melanoma. Or you may be detrimental if the patient has too high levels, and because our results are very, very, very intriguing.